Welcome to the Center for Health Affairs Board Education presentation, Hospital Finance 101. This presentation is based upon the Center for Health Affairs issue brief by the same title, which can be found on CHA's website, www.chanet.org. All issue briefs, as well as their corresponding PowerPoint presentations, are available on our website in the Publications section. This issue brief, originally released in February 2004, has been updated to reflect the most current information on hospital finance. A basic understanding of hospital finance is crucial as leaders continue to create policy that shapes healthcare financing. Following is a 30,000-foot view of hospital finance that is intended to shed light on a complex system and provide a clear explanation of how hospitals generate revenue, what their expenses are, what factors influence hospitals' ability to deliver upon their mission, and how payer and service mix affect hospitals' financial viability. There are a number of ways in which hospitals are paid for the services they provide. Private payers, which include both employer-based health insurance and directly purchased health insurance, cover nearly 70% of the U.S. population. Employer-sponsored plans are more prevalent, representing 61% of this total. Direct purchase plans represent the remaining 9%. Government payers, which include Medicare and Medicaid, also pay for hospital services. Medicare reimbursement for inpatient and outpatient hospital services is based on a prospective payment system, or predetermined fixed amounts based on a patient's diagnosis and treatment. Medicaid inpatient hospital services are also based on a prospective payment system. However, Medicaid outpatient services are reimbursed based on a percentage of the charge. The last major category of payer is self-pay. Patients who self-pay do not have insurance and pay some or all of their costs out of pocket. The working poor often fall into this category. Hospital revenues generally come from four primary sources. Patient care services, both inpatient and outpatient, represent the largest source of revenue. In 2005, 93% of U.S. hospitals' revenues came from delivering care. Patient care services include things like room and board for admitted patients, x-rays, and physical therapy. Though patient care services represent the most significant revenue stream for hospitals, it is common for hospitals to lose money on patient care services. Non-patient care services are another source of revenue for hospitals. Examples include parking garages, cafeterias, and gift shops. Hospitals can also earn revenue from investment income. However, the recent poor performance of the stock market diminishes the financial contribution this source of revenue generally provides. Finally, grants and donations are also a source of revenue for hospitals. This contribution, though very important, is not easy to estimate from year to year. Hospital expenses come from a number of different sources. Hospitals depend on a highly trained workforce to provide the advanced level of care and service that patients depend upon. It's not surprising, then, that the largest portion of a hospital's expenses is generally wages and benefits. Other expenses include other products, capital expenses, prescription drugs, professional fees, utilities, and other services. Due to the pressures from payers over the last several years to ratchet down reimbursement, hospitals vigilantly monitor the many other factors that drive their costs. Workforce shortages are a significant driver of costs, and they are not just limited to the field of nursing. Other fields experiencing shortages include pharmacists, laboratory technicians, and biller coders. As a result, administrators look for ways to fill vacancies, many of which, like signing bonuses, come with a cost. The costs associated with medical malpractice insurance have seen dramatic increases over the last few years. Spikes in lawsuit settlements and jury awards are arguably the most influential factor affecting high medical insurance rates. The American Medical Association ranks Ohio among the states experiencing a medical liability insurance crisis. Capital costs are incurred from hospitals borrowing money to pay for big-ticket items like IT advances, medical technology, and facilities construction. These expenditures help improve patient access and quality of care. Uncompensated care is care that is provided but for which payment is not received or is only partially received. It can include losses that result from free care, government shortfalls, and bad debts. A hospital's ability to remain viable is heavily dependent on its payer mix and service mix. Payer mix describes the proportion of reimbursement a hospital receives from different payers. Payer mix tends to be linked to the demographics of the surrounding community, which means that it will vary from hospital to hospital. For example, a community with a large elderly population would result in a payer mix that leans toward Medicare, while large numbers of people living below the poverty line would likely result in a payer mix more heavily weighted toward Medicaid. Northeast Ohio Hospital's payer mix consists of 47% private, 38% Medicare, 9% Medicaid, 5% self-pay, and 1% other. Service mix refers to the mix of services offered by a hospital. The mix of services matters to a hospital's bottom line because some services tend to be reimbursed more favorably than others. Surgical care reimbursement tends to be more profitable than medical care. On the other hand, hospitals tend to lose money on emergency departments, trauma units, burn units, and intensive care units. The importance of payer mix and service mix cannot be overstated. In fact, according to Bill Ryan, the president and CEO of the Center for Health Affairs, when you boil all the statistics and data down, the two essential elements that determine a hospital's ability to remain viable are payer mix and service mix. Why is all of this so important? As any business must, hospitals keep a close eye on their books to ensure their revenues are not outpaced by their expenses. A basic understanding of hospital finance and the impact of the factors outlined here is crucial as leaders continue to create policy that shapes healthcare financing. If aspects of the system further stress hospitals and force more closures, as has occurred nationwide and right here in Northeast Ohio, it will only serve to exacerbate the problems of those already facing difficulties in accessing care. This concludes the Center for Health Affairs Hospital Finance 101 webcast on demand. Thank you.